I cannot find words or ideas or terms to explain what I have witnessed or what I have seen. Just imagine the scenery in front of you, the capital of your country, a whole city was completely sucked, destroyed. Thousands of people were injured. 4 of our major hospitals were completely destroyed. 6 of our nurses died on the spot, yet the nurses did not run away. What nurses and physicians and hospitals did was a heroic measure. In less than 24 hours, everyone received care. It was like a miracle. It was a complete disaster, yet you feel proud of your people. You feel proud of their reaction. It was a very difficult experience. I learned that by our unity, we can reach our goals. We need to have this giving, whether at the individual level, at the society level, or at the national level. We need to support each other, because if one country is poor, if one country population is sick, with the globalization now, it will affect all other countries. Let us work all together, united, to have a safe and happy world.
Hello, everyone, and a very warm welcome to you all to the Lives in the Balance Summit. My name is Juma, a senior journalist at BBC News and a passionate advocate for maternal, newborn, child, and adolescent health. I'm extremely honored to moderate this event, and I want to thank you sincerely for joining us. Please do let us know on chat where you're joining us from. I am coming to you live from Nairobi, Kenya. So please, from your screen on the right-hand side, there is a chat there. Please let us know where you're joining us from, which country you're representing, and then also sample and let the audiences know where everyone is coming from. All right, Dr. Myrna from that video reminds us today that none of us, ladies and gentlemen, is better than all of us together. This year marks the 4th in a series of Lives in the Balance e-summits launched in 2020 by PMNCH and CORE Group. Thank you very much to the 2 co-hosts. And for the next 2.5 hours, we will talk about delivering on commitments in humanitarian and fragile settings. Now, about 6 weeks ago, I was in Somalia, where the worst drought in a decade is devastating lives. And I saw the tiniest 6-month-old ever. Her name is Naima, and she weighed about 4 kilograms. That is roughly about 9 pounds. And Naima's mother told me that she had not fed or she had not drunk anything for more than 24 hours. Her breasts could no longer nourish Naima, who is her only precious daughter, and who was severely malnourished and had measles as well. And you know what the saddest thing is about all this? Naima may not survive. She may die from severe malnutrition, or if she gets to a hospital, chances are very high that there may not be enough medical supplies to tend to her. And Naima and her mom are just 2 of about 274 million people who need humanitarian assistance globally today. And this number keeps rising with increases in crisis. The rains are failing, the fields are bare, the poor are getting poorer, conflicts are increasing. Look at Ukraine, look at Tigray, look at DRC, look at Nigeria. And then there's COVID-19. And in all this, women, children, and adolescents continue to just not get the essential health, nutrition, and social services that they rightfully need. Their mental health is deteriorating and they're facing a lot of violence. Now, if we want to achieve the SDGs, the universal health coverage that we are really talking about everywhere on social media, in our boardrooms and everything, we must address the situation in these humanitarian and conflict situations. And that is why we're here today, to reflect on the challenges, to share the lessons, tools, and resources, and most importantly, collaborate, and act in solidarity to ensure that service delivery for women, children, and adolescent health and well-being in these humanitarian settings and fragile settings is guaranteed. Now, our hashtag is hashtag Lives in the Balance, hashtag COVID call to action. So please make noise on social media. Let people know who may not be here with us what we're talking about today. And let's get the conversation going. And ladies and gentlemen, once again, thank you so much for joining us. And to start us off is our first session, or our opening session, is the leadership dialogue hosted by the Right Honorable Ellen Clark, PMNCH Board Chair and former Prime Minister of New Zealand. Helen, so good to see you again. And always such an honor to listen to you as you hold these conversations. Welcome to the virtual stage.
Thank you very much, Mercy, and greetings everyone from New Zealand at midnight. Well, Mercy, you just told the story of what you had seen with children very, very ill and weak as a result of the impact of drought and war in Somalia. It immediately brought a flashback to me of desperately small and ill babies whom I saw in a ward of a hospital which was supported by UNICEF in Afghanistan in March 2019, and I just shudder to think how many more children are in that situation there now. I was reflecting too, as you spoke, Mercy, that since we began the Lives in the Balance series, things have got worse for women and children and adolescents on the front lines. There are more conflicts. We've seen the devastating conflict in Tigray worsen, begin and develop and hurt so many since we began this series. And then, of course, over the last 3 months, the devastating war in Ukraine. So these are very, very tough times. And I think there are new figures out today saying that yet again, we're looking at record numbers of people around our world displaced. And most certainly there's a record number of women, children and adolescents in great need of assistance because of these wars, conflicts, crises, climate change impacts, disasters of a range of types. Around a fifth of the world's population of women and children are living in countries experiencing armed conflict. And nearly half, 43% of global under 5 deaths in 2020 happened in fragile and conflict-affected situations. So this is obviously leading to immense deprivation and loss of human rights. Also shocking, and I'm sure Natalia Kanem will have things to say about this when she speaks, up to a third of girls living in a humanitarian setting report that their first sexual encounter was forced. This is dreadful. And 2/3 of zero-dose children, that's children who haven't received a single dose of life-saving vaccines, which they should get as children, live in just 5 countries, 4 of which have undergone or are undergoing a humanitarian crisis. But I think often as we try to take in these horrible numbers, it's easy to forget what this means to people and families. And behind every single one of those numbers, there's a human story, like the one that Mercy just told. Behind every one of those numbers is some kind of terror somewhere, whether it's the maternity ward of the hospital in Mariupol, whether there were bombs and destruction at the very moment life was beginning for children. So I think the fundamental question we need to ask ourselves and our political leaders is, what kind of world order are we building for our children? Will it be a world that continues to go through these cycles of global health emergencies, climate disaster, famine, war, of course, gender inequality along with us and not going away, and increasing poverty? Or can we move on track to that world that the Sustainable Development Goals envisaged, where peace and universal health coverage and gender equality and rights for all and a better and more sustainable future is the reality? we've got some work to do. So the meeting today, I think, has to send a powerful message. Lives literally are in the balance. And we can't accept that women and children should bear the burden of these wars and crises. We must speak out with one voice for change, which will make a more equitable and peaceful world. And this is what this fourth part of the series of the Lives in the Balance Summit is about. So I've got some wonderful people coming onto my virtual couch from around the world. And we're hoping that they're going to give us some words of wisdom about where we can go from here, where we need to go, and how can we ensure that we're protecting and addressing the health and well-being of the most vulnerable women, children, and adolescents at this time of great fragility in so many places. Now, what I'd like to do is introduce each speaker as I call them, and I'm going to start with the Executive Director of the UN Population Fund, Natalia Kanem. Natalia, you know so well through the exposure you have day in, day out to these shocking crises and emergencies, how much they affect sexual and reproductive health and rights, and how much they exacerbate gender-based violence. We know that sexual violence and conflict disproportionately impacts on women and girls and causes grave and lasting harm. The pandemic worsened the situation, but these new wars and conflicts that keep erupting add so much to the burden too. So tell us, how does UNFPA support the sexual and reproductive health needs of women and girls in conflicts? And what are some of the essential things that need to be done to ensure that not only women and girls and their sexual and reproductive health and rights are protected in crisis situations, but also protecting the health workers who are striving to address their needs? Over to you, Natalia.
Well, thanks so much, Helen. Thank you first and foremost for your leadership and your deep commitment to women, to girls, to adolescents, and also Mercy Juma for being with us. This is such a timely conversation, and I'm pleased to be joined by one of the experts on UNFPA's team who's helped us to craft the view that I present, none other than Petra Tenhoop Bender, and as a midwife who's delivered literally over 1,000 babies. When we discuss in UNFPA the urgency of lives literally in the balance, my message today will be that we need to listen to the health workers on the ground. And we also need to listen to women-led organizations on the ground. As Helen has already alluded to, and Mercy Juma before her, we don't know when conflict will arise. We don't have perfect prediction ability. So we need a health system that can respond and prepare. And in the case of UNFPA, our purpose in every conflict setting around the world practically is to support governments in meeting humanitarian needs of women and girls, especially through the delivery of integrated sexual and reproductive health and gender-based violence protection services. Now, for everyone who is participating today, as we imagine danger approaching, when a woman has to gather up her wits and grab her children and flee for her life, she obviously doesn't have time to remember contraception or menstrual supplies. And if she's pregnant, she's doubly scared. So our message as UNFPA, but also as a system, which includes CSOs who are doing a magnificent job on the ground, and UN with Red Cross and Red Crescent societies. Our message and our mission is really simple: to declare that sexual and reproductive health care and protection from sexual violence is not just a luxury during peacetime. This is something essential. It's part of human dignity, and it's also life-saving as well. And sexual and reproductive health and rights of women and adolescents should be non-negotiable. There should not be a debate, and it should be built into every crisis response. So as we do our interventions, we plan. Planning is very important. Pre-positioning, very important. Modern contraceptive methods, because Very few women wish to become pregnant under conditions of danger and conflict. We have to respond to this. And one of the things that I also would like to stress just in the short moments that we have is that psychosocial care is part of care. Mental health is something that's very important. If you can interrupt a process and give that social worker the ability to sit in a safe space with that woman after something has happened, this is also part of care. So the rape kit, yes, and being able to respond if there's a danger of HIV, yes, but also looking after her mental health. This integrated approach is what we're advocating, and I'm really proud that PMNCH and our network make sure that this is also part and parcel of the development side. So the readiness is there. As we're scrambling, we know we've got to build this in. The health workforce is 70% female, and we have to focus on letting midwives lead as they do so well. During COVID, Helen, a lot of midwives were taken out of their normal duties and sent to the bigger hospital down in the main city. But that training in obstetric care, that ability to work with a woman and shepherd the situation, psychosocial support, this is one of UNFPA's most treasured training programs, because a midwife is actually typically community-based. She understands culture. Even in Afghanistan now, we've been able to keep our home services open for pregnant women due to the wisdom, I would say, of midwives. So just to end, I will say that we only succeed when we work together, and we need to ask women what they want and respond. With all the turmoil going on around the world, I'm really grateful that this is a partnership that wants to find solutions to protect the health, the rights, and the safety of women and young people, because that's when they need us most. Thank you, Helen.
Thank you very much, Natalia. And I mean, your key points. These are essential services, not negotiable, can't be put aside because there's problems. They have to go on. Secondly, let me commend UNFPA for the wonderful work it does with the dignity kits. I just can't imagine how much that means to women in very difficult situations, that these supplies come through to the camps, and they know somebody's thinking of them. And thirdly, stay close to the community, as of course our midwives around the world do. So important. And the emphasis on the psychosocial support, given the trauma so many of the women and girls have faced, is incredibly important. So thank you so much for everything.
Thank you. Thanks a lot.
Now we're going to move to Jordan. Aya Harut, Program Director, Jordan Youth Innovation Forum. Aya, hoping that you are hearing us loud and clear. We have a question for you, and it relates to the fact that adolescents shoulder a huge burden during humanitarian emergencies, not only being cut off from essential services, but many could be forced to drop out of school or can't access schools at all. Displaced adolescents face even greater difficulties. And I'm well aware from visits to Jordan over the years how many forcibly displaced people Jordan has had within its boundaries all these years. So given your work in Jordan, including with young refugees, what do you think policymakers and humanitarian practitioners need to do to ensure that adolescents are meaningfully supported, to be equal partners in response efforts that are targeting their health and well-being, including their mental health? Over to you, Aya.
Thank you so much, Helen. Thanks for everyone who's attending here, and allow me first to tell you how much of a pleasure it is to be here today and to advocate and raise the voice of Jordanian youth. So allow me first to start by defining what I believe and resources also say about equal partnership and meaningful participation. So participation is considered as an essential human right under Article 12 of the United Nations Convention of the Rights of Children. Participation is about being informed, having the opportunity to be engaged and influence decisions that eventually have an impact on individuals' lives, whether it was on a school level, the community, media, or on a higher level. such as governance. For participation to be meaningful, it has to be inclusive, solid, and built on a respectful partnership manner between adolescents, youth, and adults, sharing the power to contribute in design and the delivery of programs, plans, and policies. So before suggesting steps to enhance meaningful participation, I'll briefly share with you some Jordanian challenges. Firstly, the demographic opportunity, where by 2030, about 69% of Jordan's population would be of work age. If there aren't sufficient efforts for youth empowerment and skills development, we will face a dangerous level of unemployment rates. Moreover, about 50% of youth are unemployed, according to the World Bank report 2020. Such challenges are sustaining a negative loop of lack of access to healthcare, quality education, affecting adolescents and youth well-being. Additionally, youth lack of trust in the government and their frustration about economic situation and well-being. Still, policymakers consider young individuals as less capable, where in reality, among young age groups, individuals are providing for their families and facing challenges during crucial ages of growth and development and supposedly less responsibilities. As for refugees, they are living in an uncertain, unstable status, which limits the potentials to work or build in the country or develop their situation because they believe they can immigrate to another country at any time. And for young girls, refugees especially, they are getting married unofficially and illegally, as it is prohibited by law and camp rules, which deprives them from their basic legal rights. So how can we address that? Considering youth as equal partners require two-way direction efforts, one being policymakers and governmental bodies, and to understand where they have to understand the potentials of youth, the significant impact and value we can add to communities if given the trust and advocate support. As for youth ourselves, we require skills development, awareness of challenges, and the development plans on the national and international level, such as the Sustainable Development Goals. Practically include youth in all phases of project development, starting from designing into implementation. For example, in Jordan, the Ministry of Youth has included youth in the development of new projects and programs where they asked them to pitch their ideas, which was a failed attempt of engagement. Instead, policymakers should ensure skills development, provide solid project alternatives, and then they can engage youth to develop programs. Also taking into consideration our actual needs, for instance, a program in arts for a target group lacking basic essential human needs is ineffective, where Maslow hierarchy of needs theory can justify this recommendation. Significantly, we need to foster collaboration between all stakeholders inclusively. As for refugees, they are considered as a valuable human asset, but governments may consider them as a burden. Yet if well utilized, they can add a huge, significant value to the community and the economy as a whole. Indeed, we cannot disregard the importance of professional development, professional skills development and career development, yet interpersonal skills and soft skills, including communication skills, problem solving, should have an equal attention and effort.
Technical support. I think Aya has frozen on us in the middle of saying very interesting things about refugees. So perhaps Aya is reconnecting. Aya, are you able to come back in? I see Aya's place still on the screen, but let me come back to Aya a little later and move right along and call in Wais Karani, who is a frontline worker from Afghanistan. Wais, you are the program director. You are the president of the Afghanistan Nurses and Midwives Council. And we'd like you to tell us about the challenges that health workers, especially midwives and nurses, are facing to respond to the health needs of women, children, and adolescents. And what can the global community do to support health workers in such situations? And can I say, we are aware of the shocking, shocking time for human beings affecting your country right now. So please use this platform to tell us how the global community can help.
Hello, everyone. Thank you so much for the question. I believe that this is an important area to be focused. First of all, I would like to highlight that we will not be able to meet the health-related sustainable development goals and the universal health coverage until we do not empower nurses and midwives and until we do not address their challenges they face. They really play an important role in quality patient care, patient safety, people-centered care, in also access and many other areas. And it was very well highlighted by our colleagues from WFP, NWFP, UNICEF, sorry. On the other hand, from the global context, if we look into the State of the World Nursing report, which was released in 2020, 80% of the nurses are clustered in countries that account for 50% of the world population. And from the shortage of around 5.9 million, 5.3 million of the shortages are concentrated in low and middle income countries. So this indicates that low income and politically fragile countries remain much behind on these indicators. And there is extremely imbalanced distribution of health workforce, demanding joint efforts to overcome these shortfalls. Afghanistan, unfortunately, has remained politically unstable over many decades, and it is a very low-income country. And you all better know on this. In total, there are around 6,000 nurses for the entire population, and it is estimated that by 2030, we need around 90,000 nurses, which is beyond imagination. Nurses and midwives face numerous challenges since long, and this was doubled with the COVID-19 pandemic in 2019, and unfortunately tripled with the recent political turmoil, which happened since August 2021. And these all have further disrupted health systems and directly impacting health services for women, children, and adolescents. On broad categories, if I will share that we in Afghanistan are facing numerous challenges along beside what I have shared. There is inadequate staff, especially female nurses in public, especially in public sector, and with the recent political turmoil, unfortunately, we have lost many trained nurses and midwives from the country, and they have in the country. There is an availability of continuous professional development opportunities for the nurses and midwives since long, and higher education is still a challenge. You know that in Afghanistan, for the entire population, we have only one nursing education institute which prepares nurses as bachelors. So imagine that what level our nurses and midwives are here in Afghanistan. And these nurses and midwives are rarely seen in the leadership positions to influence decisions. Therefore, we really facing to be in front and take role in the decision making regarding to maternal, newborn, and child health. And along with that, the most important challenge which has to be addressed is inconvenient workplace environment for our nurses and midwives. There is shortage of resources and supplies. Safety is a big concern for the nurses, especially for the female staff, midwives and nurses. And the working hours and shift duties, sometimes it goes until 36 hours per shift. And against that, nurses and midwives are getting very low wages. And on the other hand, the prices of basic human needs are getting higher. Career leader is a big challenge, and there is no career leader for the nurses and midwives in Afghanistan. There are many other challenges, and I'm sure these challenges are not, confined in Afghanistan. It may also be experienced by many other countries with the similar context like Afghanistan. So Afghanistan actually needs more help and support than any other time in all aspects, particularly in the area of women, children, and adolescents' health. And I would share that we cannot ignore female from health workforce. So I would recommend that gender consideration is must for us, and we hope that girls' school will reopen soon, because this is a big concern for everyone here at this moment. investment in leadership, capacity development, and improving the hospital structure in terms of adding more nursing and midwifery job are the actual need in this time, because now we were already short of the human resources in all hospitals, but now with the recent brain drain, this issue has further worsened. So we really need additional staff, and the structure has to be improved to address the need of the population. Unavailability of resources and supplies, not only in the healthcare setting, but also in the market is still a challenge, so that we need to look into how we can import supplies to cover the need of the population. And lastly, I would emphasize that health and education must be kept away from the politics, and this is the real need of this time. And these are few areas where global community can invest and take role and or influence the decisions in these areas. Thank you.
Thank you so much, Wais. And as I said, the problems that the nursing and midwifery workforce face in Afghanistan are pretty dire. I think not just low pay, but probably no pay in quite a lot of cases, given the problems of funding the health system. And yes, the brain drain will be really affecting the health workforce there too. So thank you for those very important remarks. Last but not least, I come to Sean Baker, who's Chief Nutritionist at the USAID. And Sean, well, we don't need to tell you how dire the current food crisis is around our world, with critical actions needed by the global community to offset these devastating impacts of conflict, extreme weathers, the impoverishment that the pandemic has caused, many compounding challenges. You have been working long-term in nutrition across regions. What do we need to do to better mobilize and align as global partners to address the health and nutrition needs of women, children, and adolescents right now?
Thank you, Madam Prime Minister. It's a huge honor to be on this panel, and I'm very moved by the other panelists that really set the stage well for my remarks. I'll start off to really come back to the basic data and why nutrition at USAID is such a priority, and personally why I've been so obsessed about nutrition. I would argue it's an evidence-based obsession, and it comes down fundamentally to one percentage, 45%. 45% of under 5 deaths are attributable to malnutrition, which means that if those children had received the nutrition they need, they would be alive today. What other may have been the other cause of death? And then perhaps as importantly, for those children who survive malnutrition, we know we have fundamentally deprived them of their optimal cognitive and physical development. So we've basically locked them into a cycle of underdevelopment, which is just unacceptable. Now, the magnitude of the problem, and if you sense a certain outrage in my voice, is because we actually have an incredible set of evidence-based solutions that work and are cost-effective. And we've not gone to the scale we need to do to change that trajectory. Now, if you recall back into late 2019, 2020, I think it's sometimes difficult for all of us to call back, we are actually in nutrition at a relative sense of optimism. We had been making progress, particularly since 2008. Not enough, but we were seeing this cusp that, we were ready to break through and really fundamentally change the trajectory of undernutrition for mothers and kids. And then, and I think it's encapsulated in the title of this conference today, we're in this perfect storm of COVID, climate crisis, and conflict that is devastating, and particularly devastating to the nutritional status of moms and kids. And to dig into some of those impacts, there was analysis of the COVID pandemic estimating that we'd have an additional 13.6 million children suffering from wasting, the most severe form of undernutrition. And that the combination of drop-off of nutrition services and increases in wasting could result in an additional 280,000 child deaths. If you dug into the multiple pages of the 6th assessment report of the International Panel of Climate Change, you will see, and I will quote, children in low-income countries will be at greater risk of undernutrition from these multiple climate change impacts. And if you read through that report, it's just devastating how bad the impacts on moms and kids will be of nutrition. And it's important to underscore, these are children who did absolutely nothing to contribute to creating the climate crisis. And then conflict, I think it's been laid out already, the devastating consequences of crises that are ongoing, and then the relatively new crisis of Ukraine, of Russia's invasion of Ukraine. What's different there is that it's destabilizing the entire food system, which is having immediate consequences on the supply of nutritious food, because households spend so much of their income on food. If the food prices go up, they have to deprioritize those most nutritious foods, which are essential for mothers and kids. And UNICEF just earlier this week indicated that the price of commodities, these ready-to-use therapeutic foods that are so essential to save the lives of children, such as Grace described, are likely to increase by 16%. Well, that means 16% fewer kids are going to get those treatments. So we know this is why, because of the importance that USAID has made major commitments, most recently at the Nutrition for Growth Summit in Tokyo of 2021, where we announced the intention to invest over $11 billion over the next 3 years across humanitarian assistance, our health programming, and our resilience and food security programming. Because we know as a community that to make real progress on nutrition, different sectors need to come together. But here I really want to emphasize the opportunity on the table through the health sector. I think together we have a community of people who have dedicated their lives to saving children, children's lives. And there's a huge opportunity to close the gap in delivery of health services. And I'll go back to another very essential publication that came out in 2021, the Lancet series, the 3rd Lancet series on nutrition. And it said, and I'll quote, low coverage of nutrition interventions relative to the reach of the related health services suggests that closing this opportunity gap is a first step for accelerating progress. Well, what does that mean? That sounds very dry and academic. It means moms come into prenatal services, but they're not getting their iron folic acid or the multiple micronutrients, their counseling on nutrition. We know this reduces their risk of anemia and then death and postpartum hemorrhage, helps their children grow. Mothers are having attended births, but they're not being supported to initiate breastfeeding in the first hour. Although we know if we can scale up optimal breastfeeding, we'll save 800,000 children's lives a year. Moms are bringing their kids into health services. Those children are not being screened to see if they need treatment for acute malnutrition. So we're only reaching between 20 or 25% of those children who need those services. So if we can close this opportunity gap, we can do it quickly. And I think there's a real note of hope in this because, and it comes back, and Mr. Karani, Dr. Kanam, you stressed it. If we support the frontline health workers, the community health workers, and the primary healthcare workers with the right training, the right supervision, we absolutely know they can deliver this. And they are the people on the front lines, the most resilient part of the health system, and who know their communities, who can communicate effectively. And so, and personally, I've witnessed just how transformative these frontline workers can be in the lives of moms and kids, and the incredible satisfaction the health workers get and the families get. So I think that, to me, if there's a message to take away, is that let's seize this opportunity of scaling up these interventions through the platforms we have, and it can really help offset and save lives immediately and set kids up for a much better future. Thank you so much.
Thank you, Sean, for that very rich contribution with just some incredible facts and figures. And I think that phrase, that our children's health and well-being is so affected by these 3 C's, the COVID, the climate, and the conflict crises, that there's some bigger forces at play here. But thank you for all you and USAID do to really really work to make a difference on these most fundamental issues of nutrition. 13.6 million children wasting, you know, every single one of that 13.6 million, a human story. So I don't see that the minister from Democratic Republic of Congo is online. I'm told that we don't have a lot of time. I'm going to ask Aya to come back in and just sum up from where she was very, very briefly, because we lost Aya. Aya, have we found you again?
Yeah.
If we have, you have the microphone.
Thank you. Thank you. And as we were saying, some crises happen and we need to be prepared for that. So just to summarize some of the steps or the recommendations I was suggesting to support policymakers actually increase the active and meaningful participation of youth, we need to ensure an evidence-based approach, work closely with the target group, focus on professional skills and interpersonal skills and soft skills just as much, for its impact on the well-being and engagement in the community, whether it's in a small content, schools or community as a whole, all the country and international citizenship. So we need to research first, study the gaps, understand the needs, and based on that, we can develop programs. And why do I say that? And how is that going to help? Well, at first, it's going to improve the services and policies across development and humanitarian contexts where adolescents and in general young individuals, we have better understanding of our own challenges, our communities, our goals and dreams. So if engaged sufficiently, we can enhance effectiveness and relevancy of the services, policies, and programs. Most importantly, sustainability, since the resources will be utilized to address the right needs, where programs are pouring into the challenges directly. So we are ensuring that we're not wasting any resources. Also, adolescence is a critical period of rapid growth, learning, adaptation, and neurobiological development. Support and empowerment at this age will have a great impact on the community as a whole on the long run. Also, youth and adolescents can become active members to enforce accountability on governance, which can enhance their achievements and their performance. All in all, engaging youth will enhance the feel of ownership, whether to the programs, policies, or strategies, which will increase participation rates. And I'm talking as on an NGO level, working with youth, we can enhance the participation rates when we make them feel included and part of the program. In the words of one of our volunteers, who's also a refugee, she said, after volunteering, I learned how to give back to my community and how can I help others without waiting for anything back in return. I feel that I belong. And this is why I mentioned that as much as it's important to work on the community itself to understand and respect differences, we need to work on minorities and refugees to feel that they belong. They are part of the community. They want to give back to it. And it's a mutual benefits for everyone. So this is why I also promote for collaborative working with all stakeholders, working together and develop an ecosystem where everyone is working hand to hand to support youth, adolescents, and especially the ones in fragile settings. Thank you.
Thank you so much, Aya, for those words, speaking for adolescents and youth. Very important. We have online now Dr. Jean-Jacques Mbugani of the Democratic Republic of Congo, who is the Minister of Public Health, Hygiene and Prevention. Minister, your country, as we know, has suffered one of the most complex and long-running humanitarian crises in our world. Are you able to tell us just briefly how the government is working with partners to address the health, nutrition and well-being of the most vulnerable children in the countries? And what are some of the key considerations the partners need to get right as they mobilize in support of your country? Over to you, Minister. The Minister is going to reply in French, but people, if just go to the channel of interpretation for your language and you will be automatically hearing the translation. Minister, s'il vous plaît. The Minister is on mute, if the interpreters could advise of that.
Ça va mieux? Allô?
Is that better? Are you hearing me? Hello?
Okay. Thank you very much. Merci beaucoup.
Thank you. Thank you very much for giving me the floor and in particular the opportunity to reply to your question. It is true that health indicators indicate the burden of humanitarian crisis on health, and particularly on women and children in the Democratic Republic of the Congo. This is evident. There are very high levels of malnutrition. The rate of use of the system is low. However, the country is experiencing a reduction in the mortality rate among children, and this is explained by the improvement of some indicators since 2018. The rate of use from 50 to 57, the rate of deliveries, which has increased. The use of modern contraceptives from 8 to 21%, the increased percentage of newborns benefiting from improved care, the improved quality of care given to children, and increase of entrance to the care of children, the availability of care given at the provincial level. There continues to be malnutrition in vitamin A for a large percentage of children under 5, a good coverage of primary care for mothers and children. In order to reach these results and to continue to progress, we have a strategic plan, which is a priority for the country in order to resolve the problems of the population, particularly among the vulnerable group of the children. These documents were prepared in collaboration with development partners in keeping with their commitments taken at the Kinshasa Forum to improve the health situation in the DRC. All the projects take account of the priorities of the country. This is the case of the multi-sectoral project for nutrition financed by the World Bank, as well as other technical and financial partners. These all align with national priorities in the implementation of the Paris Declaration with regard to development assistance. We should also mention the mobilization and continued commitment of communities in resolving different health problems, especially as regards children. The government is also willing to access development programs relating to health, and this is underscored in the strategic plan, which runs until 2023, and the government's action plan. Additionally, with regard to nutrition, the contribution of nutrition to the health crisis, to increase nutritional monitoring and food security, have pre-school monitoring, vaccination, and supplementation in vitamin A and other vitamins that lack, to improve health structures for dealing with malnutrition, strengthening the resilience capacity of households at the community level. I would conclude by saying that our country has more than 8 million children who are malnourished, and 27 million people who are not in a situation of food security, and this undermines the security of our country. Thank you very much for your attention.
Merci beaucoup, Mr. Minister. And well, a sobering note to end on: 8 million malnourished children in Democratic Republic of Congo again. So we have work to do to advocate globally for meeting the needs of women and children and adolescents in these times of multiple complex and compounding crises. And fortunately, through the Lives in the Balance series of forums, we've been able to highlight the situation, also listen to what the solutions are, what the partnerships are that can make a difference. And everyone who's contributed today is in their various capacities doing their best to make a difference for others. Now we will have to close the session on the couch because time is ticking on and we began a little late. But let me thank all our panelists once again and throw it back to Mercy, the overall moderator of today, to take over from me. Mercy, back to you.
Thank you. Thank you very much, Helen, and thank you very much to your wonderful panel for such a passionate discussion and just bringing us, the experiences in their line of work and how we should move on from here. Thank you very much. And all the very best to those who are living. Thank you very much again for joining the Lives in the Balance. For ladies and gentlemen, on that note, I want us to move to the next session of our program. And I won't say much. I think that the speaker who's coming next, a very, very brilliant young lady from Ukraine, Yana Panfilova, co-founder and CEO of Teenergizer. Let's just get to hear what she says, and this session is termed Perspective from the Frontlines. Yana, really good to see you, and thank you so much for joining us today.
Thank you so much. So hi everyone, my name is Yana. I'm from Kiev, Ukraine. I'm 24 years old and I'm living with HIV. Until February 24, I thought that growing up with HIV was the biggest challenge I would ever face, but I was wrong. In recent months, the Russian war in Ukraine has turned lives upside down for millions of young Ukrainians, especially young women and children. You have all read the statistics. Over 12 million Ukrainians have fled their homes since the start of the war. Today, an entire generation of my friends, our peer counselors, young women, students, and children have fled their cities, towns, and villages, our homes and studies, and members of our families. We are not statistics. There is a tragic story of depression and desperation behind each internally displaced person and refugee. Millions of women and children are now alone in other countries, trying just to survive and wondering what will be left in our families, in our homes when we return. And millions more, mostly young men, are still in Ukraine, defending our cities and our homes against an army that is raping and killing, but still has not even declared war. Our men are protecting our homeland from Russians' bombs and bullets that are costing us our lives and our safety. The Russian soldiers, with their landmine and bomb attacks, are so much more deadly than any invisible virus like HIV or COVID. Today, I'm speaking to you from Berlin, not as a tourist, not as a statistics, but as a refugee. I may be a refugee, but I am among a very fortunate. I have food, I have temporary home and access to free HIV treatment and support for the people of Germany. But thousands of young people under foreign occupation in Mariupol or Kherson or killed in Irpin, Bucha, Chernihiv, they have been not so lucky. As the founder of Teenergizer, the largest youth network for young people with HIV in Eastern Europe, Central Asia, I don't even know when and if we're able to find all of the young people and adolescents in our networks network in Ukraine? Are they now in Poland or still in Kiev or Odessa, already in Moldova? We have been able to reach only 50% our members. It's like part of my body, our staff, my friends and their family has been amputated, but without anesthesia. My mans tell me they should still be there, but when I call them, there's no answer. I have never been one to give up, but this war has given me a lesson in solidarity with young people in Afghanistan, Palestine, and Yemen and Syria, and young people living through other conflicts that dragged on longer than the war in Ukraine. I hope other young people never experience the toxic cocktail and anxiety, risk and isolation that we are facing today. War, COVID, homesickness, loss of relatives, forced separation from friends, rapes, lockdown, gender-based violence, and limited access to services for health, including sexual and reproductive health. All of this create another pandemic of mental health, illness and insecurity. For adolescents and young people, mental health is essential. It's like oxygen of water we needed to survive. But in the rush to recover for the war and COVID, we have forgotten that the mental health of young people and adolescents will not recover quickly. For young people facing a combination of challenges, like young people living with HIV or other chronic conditions in Europe and Eastern Europe, it's even more complex. It is over 40 years since the first cases of AIDS diagnosed, but society still fears people like me living with HIV. Every year, young people with HIV are still dying not from virus, but from the fears and social stigma created by discriminations. Sometimes it feels safer to hide in the shoulders with HIV or even being gay or being migrant that it is to us to help when you are fear you're going to be treated as a second-class citizen. We spent years fighting so that young people living with HIV could have our health and rights protected. And now it feels like our gains have disappeared overnight. Even during the war, we continue to provide online peer counseling for 2,000 young people in a month. I'm proud of my work, but our model is based on volunteer, and we can only support a small number of the millions of young people who really need help. Who is supporting the hundreds of thousands of young people we can't even reach? I'm grateful for many of the international partners who are working around the clock to help the people of Ukraine to survive this war. UNICEF, the government of Canada for your financial support, and UNAIDS, UNFPA, and WHO and PMNCH for giving a platform to young people like me to tell our stories. But even after this war is over, young people in Ukraine will be suffering with the mental scars of these conflicts for years to come. During and after this crisis, we must ensure young people and especially adolescents have access to professional mental health services, especially peer counseling. I would like to end my speech reminding you that this war was not started by the young people. This war between the old world and new world. We are young people who want to live and build this new world where the no wars, where pandemics like HIV, tuberculosis, or COVID are ended, where poverty is solved. And this new world, every person, no matter who you are or who you love, what language you speak or what passport you hold, can enjoy freedom and to choose live their lives with dignity. But we will be also the generation that rebuilds from this tragedy of this war. Yes, our lives are hanging in the balance, and I'm counting on everyone to show the strength and bravery in this moment history demands. Be brave like Ukrainians. Thank you.
Wow, Yana, very deep words and reflections. Thank you so much. You say we're not statistics, and there is a tragic story of desperation and depression behind each refugee. Thank you very much, Yana, for giving us your experience and the experience of thousands, tens of thousands of other refugees, teenagers, children, adolescents from Ukraine and across the world who have to live and endure being in a toxic environment. And you know, the toxic stress of living in a conflict zone, like you say, persists long after the conflict subsides. And it really renders those who have experienced conflict vulnerable to poor mental and physical health. You speak of a new world, Yana, and that's what you are hoping for and calling all of us to be brave. And I extend this call to everyone who is watching us today, everyone who is participating. We talk about all these in our boardrooms, in the settings like we're in today. But I think we should feel very guilty if these conversations end here with us today and here with me and you. It is our duty to take these conversations beyond the boardrooms, beyond this Zoom meeting, beyond these online meetings. And you can do that in your own individual capacity. So today, I hope we all feel really guilty, but we don't give up. And on that note, please allow me to welcome the keynote speaker, Her Excellency Kersti Kaljulaid, UN Secretary General's Global Advocate for Every Woman, Every Child, and former President of Estonia, who is coming on stage to give a keynote speech.
Dear friends, we are here today because the health of women, children, and adolescents is under attack through compounding crisis of conflict and climate change, as well as policies that shift priorities, cut funds, and restrict access to care and human rights. Thank you for gathering and thank you for caring. The global pandemic helped to crystallize just how vulnerable the health of women and children can be. And as instability grows, the goal to ensure every woman, child, and adolescent survives and thrives is at increased risk. The only thing to do is to come together, commit to health, and take actions that support and enable the delivery of basic health services to every community around the world. Half of the world's population are living in humanitarian and fragile settings, and there is a record high number of conflicts. Since February 24th, Russia's unjustified and unprovoked invasion of Ukraine has devastating effect on the people of Ukraine, in particular the most vulnerable. Ukrainian women and girls have been the victims of the unseen barbarity that the Russian forces have unleashed on civilians in Ukraine. As Yana just shared, the current war in Ukraine is a prime example of how these crises start and how political fragility directly impacts the lives and health of women, children, and teenagers. Now, and of course, in the long term, as atrocities seem to be reported every hour, Ukraine is top of mind and of great concern. In contrast, though, many of the 56 active conflicts have been going on for years in countries home to over half the world's people living in poverty and long past the international news have moved on. Crises are felt globally, but the effects are especially hard where social and economic conditions are already unstable. In every setting, the health of women, the health of children is impacted acutely. Please look at East Africa. First, severe drought, then the economic impacts of the global pandemic, and now the war in Ukraine, which is further impacting food supply. This already unstable region is experiencing food insecurity that could cause malnutrition in 5.5 million children. Shifting to Syria, 11 years of conflict have set development back 25 years. Essential, basic services like health, nutrition, water, sanitation, and education have all but stopped. In addition to concerns of severe hunger and the collapse of services, there has been a resurgence of polio in Syria, cholera outbreaks in Yemen, Ebola in the Democratic Republic of Congo. Between 2009 and 2017, there were 364 disease outbreaks in 108 refugee camps. These realities are a stark reminder that crises last for years. What kind of future are we looking at if we leave current and future generations fighting to survive, only to bear the burden of years spent without the support they need to be healthy, productive, happy? Some of the impact is physical, easy to see, but the mental impact, as severe, is invisible. When people, especially women and girls, are driven from their homes, they are at particular risk of falling prey to traffickers, forever changing the course of their lives. It's a lot to take in, but we are talking about real people, women, children, who are simply trying to live their lives, stay healthy, raise families, go to school, make dinner, in the midst of the most dire of circumstances. For the sake of each woman, each child and adolescent, and for the sake of ourselves, we must move beyond talking and start implementing a rights-based approach that focuses on equity and addresses the needs of the most marginalized. It is encouraging that prior to the global pandemic, the world was making progress toward improving the health of women, children, and adolescents. But this progress was admittedly fragile and halted in 2020 abruptly, with a turn in focus and loss of funding. Unfortunately, it seems that the threats will only continue to evolve. The goal of every woman, every child, and the Partnership for Maternal and Child Health is to leave no one behind. We must restore the funding to programs that support the health of women, children, and our youth. We must also prioritize building systems resilient to these ongoing shocks. In addition to funding, we need preparedness. We need response mechanisms that address the needs of people experiencing the ongoing and compounding crisis. Effective mechanisms will specifically address humanitarian settings and prioritize the protection of healthcare workers themselves. Uninterrupted access to quality primary healthcare, especially in the presence of conflict and crisis, can save and improve lives. And let us also understand that money spent in each and every country will remain in the economy. It will help to grow economies as well. But if it enters at the point where there are the most vulnerable, children, women, health workers, it will benefit these people much more than simply building or rebuilding infrastructure. Thank you for caring. Thank you for thinking along.
Thank you. Thank you very much, Kersti Kaljulaid, the UN Secretary General's Global Advocate for Every Woman, Every Child, and former President of Estonia. Thank you for that keynote speech. Yeah, I don't know if I'm the only one who's getting the chills when those numbers are mentioned. You know, when you talk about millions of children, millions, hundreds of millions of women, children, and adolescents suffering. I don't know if you could just close your eyes and try to figure out what those figures are telling. I'm actually feeling, I hope I'm not the only one. If you are also getting chills, just give me, a hand, thumbs up, or, a hand or something on Zoom. And again, like Kersti has clearly called us or put us to task, that we cannot afford to not talk about these women, children, and adolescents. And ladies and gentlemen, we now move to what we call the commitment session. And in this session, we are going to look at how meaningful government commitments and effective political leadership, combined with robust partner engagement and action, can sustainably alleviate the exacerbating health inequities that women, children, and adolescents face. And we'll look at what some countries have done so far, discuss the gaps that are there, and also how partners can come together to address these gaps. So our panelists for the coming session come from Bangladesh and Zimbabwe, Before I introduce panelists from these two countries, we are going to, first of all, watch a video showing how Nigeria and Malawi are continuing to fulfill their commitments and delivering on the promises they have made, and also get to hear some remarks from two key people who I will introduce after the video. So let's first watch this video from Nigeria and Malawi.
Hello, I'm Tony from Nigeria and welcome to Abuja. The humanitarian crisis in Nigeria has deepened. As people are fleeing insecurity, more people have been displaced. The impact on the economy is putting the more vulnerable people even at more risk than they had been. The good news is that we've made a lot of progress. And I've asked Dr. Salma, the Director of Family Health of the Federal Ministry of Health, to tell us some of this progress that Nigeria has made. And here is what she has to say.
I think I want to mention in order of priority. The first is the establishment of the RAMCA, Reproductive, Maternal, Newborn and Child Multi-Stakeholder Coordination Platform, because it helped Nigeria to ensure that we have a harmonized approach. I think the most important stride also we have recorded in the last 1 year is around a programming for adolescent health. The policy that was launched is very articulate, very comprehensive beyond the health sector. It includes development, which means even education and all sectors of development. And it has more attracted and placed the young people at the center stage of contribution to all issues, right from planning and implementation of activities. We cannot also ignore, as another important achievement that we made, issues of gender, because the worst affected also are young people, women and girls. And we have seen exacerbation of gender-based violence in Nigeria during the COVID period, especially within the first phase. So it has helped us to step up action and more commitment towards addressing issues of gender. That also led us to revise most of our policies in Nigeria to ensure that gender-based issues are mainstream.
It's about partnerships, governments, civil society, and communities working together. That is how we can deliver on commitments to keep women, children, and adolescents safe.
Welcome back to Malawi. Since the last time we met, the humanitarian crisis has become more severe. Many parts of the country were affected by the tropical storm Ana and other climate shocks. In addition to this, prices of food and other necessary commodities continue to increase, thereby making life more difficult for women, children, as well as adolescents. This is why we need the government of Malawi to deliver on the promises that were made. Join me as I talk to the Director of Reproductive Health Services from the Ministry of Health to hear more on the progress that has been made on this commitment.
Indeed, the Malawi government, through the Ministry of Health, made commitments towards the partnership with maternal, newborn and child health on COVID-19, the call to action. And I would say that as of now, 80% of the commitments have been made, because there were 7 commitments that we made and we have made 5 out of the 7. We are remaining with the finalizing the functional review in the remaining 18 districts, because it was 10 out of the 28 that were done. And the National Reproductive Health Service Delivery Guidelines, whose commitment was to be met in 2023. Thank you.
Kudos to the government of Malawi for the milestones achieved so far, and it looks promising that the other remaining commitments will be fulfilled. Together, my fellow youth and I will continue to follow up on government to hold it accountable to its citizens, especially to women, children, and adolescents. Yay!
Thank you very much once again. And before I move to now fully the commitment sections, please allow me to just pass my sincere gratitude to people who are joining us from all over the world, actually. I can see Melis Woodham from Turkey, We have someone from Mombasa, Kenya. Hello, fellow countrymen. We have Alok Saheb from India. We have somebody from Hong Kong. We have Uganda. We have Nigeria. We have Jordan, the USA, South Africa, South Sudan, Niger, and the DRC. Oh my God, so many countries represented: Zimbabwe, Kampala, Uganda, Monrovia, Liberia. So really thank you all so much for following us, and just following this conversation on the live stream. We really, really appreciate. And yes, please keep it here for the next about 1.5 actually 1 hour in a few minutes, as we discuss the commitment sections. And to kick us off, please allow me to introduce on the virtual stage Mr. Ted Chaiban, who's a global lead coordinator for COVID vaccine country readiness and delivery partnerships, and also Dr. Margaret Agama-Anyete, who's the acting director, health, humanitarian affairs, and social development at the African Union. Mr. Ted.
Excellencies, partners, ladies and gentlemen, I would like to thank PMNCH for organizing this important summit. I regret that I cannot be with you in real time and am coming in by video. My contribution will focus on increasing COVID-19 vaccination coverage with a focus on high priority groups: health and other frontline workers, the elderly, and people living with comorbidities, to protect lives while strengthening healthcare systems, especially in humanitarian and fragile environments. We realize today that the biggest inequities in COVID-19 vaccination are not just between high-income and low-income countries, but also between the general population and those who live in fragile and vulnerable settings, many of whom are women and children. With 11.7 billion doses administered globally, 74% of people in high-income countries have completed their primary vaccination, vis-a-vis 13% in low-income countries and only 8% in fragile and conflict settings. The COVID-19 Vaccine Delivery Partnership was launched in January by UNICEF, the WHO, and GAVI to support in-country vaccination delivery in the 92 advanced market commitment countries, with a focus on providing urgent operational support to 34 countries that were at or below 10% full vaccination coverage in January 2022, representing half of all the unvaccinated population in AMC participants. These include some of the world's most fragile settings. Among the countries with the lowest vaccination rates, we are starting to see diverging trends. Since January, the number of countries with vaccination rates at or below 10% has dropped from 34 to 18. Of the 18, 14 countries are facing humanitarian emergencies. This means that the world's most vulnerable people, including refugees and internally displaced, are likely to be vaccinated last, if at all. However, this should not be a reason to slow down. Some countries in fragile settings have managed to accelerate vaccine uptake despite the emergencies they face. In the Central African Republic, the vaccination rate has doubled since January to reach 20% due to strong community engagement, proactive collection of behavioral data, and the debunking of myth using community radios. Strong leadership in Chad and Ethiopia has allowed for similar progress. What we need to focus on in these settings is to pursue COVID-19 vaccination in a manner that recognizes other health and humanitarian priorities and uses COVID-19 vaccination as a way to strengthen health systems. Vaccinating healthcare and other frontline workers and the elderly against COVID-19 protects them from serious disease and death, and from loss of income due to loss of working days. Countries that have been able to increase COVID-19 vaccine coverage have done so through campaigns, and we need to make sure that these are quick, targeted, and take into account other health and humanitarian priorities in terms of sequencing and opportunities for bundling and funding. In humanitarian and fragile settings, successful vaccination can take place by integrating COVID-19 vaccination into the package of humanitarian services provided to the population. We need in particular to focus on IDPs and refugees and support those that are accessible in camp and other settings. COVID-19 vaccination is an opportunity to strengthen the health system, not only the cold chain, but the strengthening of health management information systems and the onboarding, training, and remuneration of healthcare workers. In Ethiopia, 5,000 surge workers bought in to address the pandemic will now stay on in the system to support with other primary healthcare activities and strengthen capacities to be prepared for future pandemics. As we prepare for the next pandemic and the integration of the COVID-19 response into primary healthcare where it belongs, it is important to continue to address the current pandemic and use the assets and resources associated with the response to address inequities and protect the most vulnerable. Thank you.
Thank you. Thank you very much, Ted. And now please allow me to welcome on stage Dr. Margaret Agama-Anyete from the African Union. Margaret, good to see you. Thank you for joining us. Hello.
Thank you very much, and thank you for having me this afternoon. And indeed, the Commission sends its greetings to you and all of your listeners. You know of Africa's Transformative Agenda 2063, which is closely aligned with the SDGs. And it seeks for a continent of whose citizens are healthy and well-nourished. And given that we have over 51% of our citizens who are women and children, most of the policy agendas which are set by the Commission really indeed target this group. Unfortunately, Africa today has 80% of the global humanitarian burden. And situations such as those in the Sahel, the Horn of Africa, in Eastern and Southern Africa, which are both natural and man-made due to conflict and other undesirable situations, make this situation worse. Of course, external situations like what is happening in Ukraine, which has already been spoken to, also contribute to undermining progress which has been made in the area of nutrition and indeed on sexual and reproductive health. Also, the fact that the continent broadly is also unprepared and has weak preparedness systems in place to deal with many of these issues which result in humanitarian situations. And of course, we cannot forget the issue of climate change and climate-driven humanitarian situations. Now, our conversation this afternoon, I've been listening to many speakers, is quite timely, and it's coming at an interesting time given that we have 4 major events which are taking place across the continent and provide the opportunity to really look back, interrogate, learn from best practices and lessons learned, and make progress towards finding durable solutions for those in humanitarian settings, particularly for women, children, and children. The first is the fact that we have made significant progress towards the establishment of Africa's own humanitarian agency. It is currently, the documents are currently going through the policy organs, and it's expected that this agency will be established soon for and of and for Africans in order that the continent then owns its own humanitarian situations. The second is this year is the year of nutrition, and emphasis is being placed on nutrition and food security. And we know the value of nutrition in terms of health, education, labor, and productivity. And previous speakers have spoken to this. And of course, the strong relation between nutrition and sexual and reproductive health, and ensuring that our adolescents and young people are well nourished as they grow and form their own systems. The next is COP27 is actually going to be held on the continent in Egypt. And with a focus on, we expect to take advantage of the space in order to focus on climate-driven humanitarian situations across the continent. And this is an important space that we hope that the youth will occupy. The last but not the least, and I didn't say in any order of importance, is that next week, our most senior, our heads of state and government and our foreign ministers from across our 55 member states shall be in Malawi to discuss the humanitarian situation across the continent. And their intent is to place focus on some of the areas which have also been mentioned by other speakers on the relation with, between health and particularly the lessons learned from the COVID pandemic and how it's impacted our humanitarian situations, particularly women and children. We know that access to sexual and reproductive health services were broadly undermined during COVID, and access to nutrition and ensuring that our children had appropriate nutrition during COVID with all the lockdowns was also severely undermined. Our heads of state and government will also be looking at matters related to climate change and humanitarian situations, and also the impact of natural disasters and conflicts on humanitarian settings, and putting in solutions which we hope shall be durable. So let me give you 5 takeaways, which I think will be important, particularly also since the Commission is working on extending its CAMA program, the Campaign for Accelerated Reduction of Maternal Health in Africa, which has been expanded to ensure that all preventable childhood deaths end by 2030, and also is being extended to place strong emphasis on nutrition. Now, my 5 takeaways would include the following. We need data. We need stronger and better data, because data shows the multi-dimensional and integrated cross-cutting nature of the issues that we have been speaking about this afternoon, the link between nutrition and reproductive and sexual health, and of course, humanitarian, what's happening in humanitarian and conflict settings. And not enough data and good data is coming out of that area. We also need increased financing in order to ensure access and equity. And one of the outcomes of the summit next week will be advocacy for increased commitment and pledges for the humanitarian situations across the continent. The third area really is to place emphasis on adolescents. Everybody speaks for them, about them, and they don't have enough space to speak for themselves and to access the services that they need. We also have to have increased to monitor, evaluate better, and improve our accountability, especially for what is happening in humanitarian and conflict settings, because if we are not accountable, we cannot expect to engage some of the other actors that we expect to be more engaged, such as the private sector, our regional economic communities, and of course, our civil society organizations, some of whom have been mentioned. And last but not the least is stronger and better partnerships for RMNACH. I hope I got that right this afternoon. Really, we need much stronger partnerships, broader partnerships, more integrated partnerships, community-based partnerships that come right up to the top, and for their voices to reach our policy makers at the highest level. So that will be my take this afternoon, and thank you very much.
Thank you. Thank you very much for those very, very, very solid 5 points. And now, in the interest of time, I will want us to quickly go into the panels. And please allow me to welcome on stage a very, very great team from Bangladesh. Professor Dr. Roshan Ara Begum, who's a former president of Obstetrical and Gynecological Society of Bangladesh. Welcome on the virtual stage. We also have Dr. Ezatullah Majid, Chief of Field Office, UNICEF Cox's Bazar. Welcome on stage. And lastly, we have Ms. Mijadi Sabrina Flora, who's the Additional Director General, Planning and Research Directorate General of Health Services, Government of Bangladesh. You're very much welcome. Really good to see you. And thank you so much for creating time to be here. All right, great. I will start. Thank you very much. I will start with you, Professor Dr. Roshan. Just very briefly, can you tell us what are the particular challenges that civil society partners have faced in amplifying the needs of WCA, women, children, and adolescents in humanitarian situations?
Thank you, Marcel Juma, and thank you, PMNCH, for inviting me. Actually, our Bangladesh has made remarkable progresses in the last 20 years in the lives of children, women, and adolescents in a relatively short time span. And we achieved the MDG goal on under weight children and hunger, and improve the gender priority in primary secondary regulation. Child and maternal mortality reduces, and we save our safe drinking water and basic sanitation facilities and the economic growth. And our 3 billion Bangladeshi women are employed in the various ready-made garments, and women are also involved with the small and medium enterprises. From top to grassroots, private and public sector women are Bangladesh are prominent in shaping the country's development. But at the same time, we see that 82% married women suffer from gender-based violence, and pervasive sexual violence prevents women from achieving their full potential. 66% getting married before the age of 18, and 29% before the age of 15. High level of stunting, quality of education, gender-based discrimination, and lack of opportunities of girls for the women. And we need to direct more attention to quality services in disadvantaged areas, lagging behind in human development, including urban slums and hard to reach area. During this pandemic, civil societies faced and experiencing damaging consequences for years to come. Most deprived and marginalized children are being hit hardest by the pandemic, exacerbating existing inequalities and pushing the most vulnerable children even further behind. Too many children missing the school. They may never return as their parents losing a job, children suffering from hunger, more stress, and experience more violence. So civil society not alone, but with the government and other stakeholders to take action to protect generation of children by making sure to continue to have access to health, education, social protection system, and protection from the violence, and their girls are full during the pandemic and beyond. Our shared humanity demands a global response. We must protect our children generation. And in our country, changes rapidly in many ways in the terms of demography. The current adolescents are 36 million, near about. It is the period one of the current transitional span. Adolescents, girls faced gender-based violence within their families, child and early forced marriage, which pushed their health, education, and general well-being. Their lives are restricted, want to go to school, but disappoint the situation combined with the pre-existing discrimination. Lack of proper nutrition, have little or access information about sexual and the reproductive health education. So they cannot choose the career for their education, and they cannot choose the way to marry.
Dr. Roshan.
How to marry? Yeah.
A bit.
Yes, I will want to. Our maternal health also, we are working in our. I can say that during this pandemic, our maternal, though they are suffering, but what the achievement is that it reduces the maternal mortality. But still, we are facing some sort of but in this pandemic area, our civil society, government, non-government organization, especially the UNICEF, also helped us a lot. And we are facing again by the climate change. In the climate change also, we are facing a lot. We are through this climate, our adolescents, our mothers, they are suffering because in the climate change, most of the impact on the adolescents, girl and the women, especially from the last one research, you have seen that this climate change hits the maternal health, is more suffering from the eclampsia, pre-eclampsia, and diabetes, and also they are suffering from the sexual diseases. So we believe that we have to overcome this situation for this government. Yes. Thank you.
Thank you. Oh, wow. Thank you. That's a lot of information. And I think what stands out for me is that when you say you have about 36 million adolescents in your country. And yeah, Ms. Sabrina Flora, just with that figure in mind, what key institutional efforts have been undertaken to just accelerate progress against the commitments have made by the government, keeping in mind that you have to deal with such a huge number of people and a huge number of women, children, and adolescents?
Thank you very much. Thank you for inviting us to take part in this important discussion. As you know, that Bangladesh has a very good infrastructure in terms of primary health care services, particularly in the rural area. So that helps us a lot in providing antenatal care, postnatal care, and also giving care to the adolescent and children. And particularly, we have community clinic, which is a community healthcare center at the community level, which provides service to 6,000 population. From that community clinic, actually all kind of services are given to the mother and neonatal health and for children and the adolescent. That is one of our strengths, you can say. And during this pandemic, actually, for the first couple of months, all the essential services actually was hampered, including the maternal care and also the other essential services. Even
I think we are losing you.
Strongest program in Bangladesh, which is being
you're losing you, Sabrina. You're
by the global field. Even our honorable Prime Minister was, but that also was kind of in a tough condition during the.
Sorry, we are losing you, Sabrina. So as we rectify that and just check on her internet and network and see if we can get back or her back on, let's hear from Dr. Ezatullah Majid, who's the Chief of Field Office, UNICEF's Cox's Bazar. And you know, sorry, I'll come back to you shortly, Sabrina. Dr. Majid, how are UN partners on the ground ensuring the continued prioritization of women, children, and adolescent health throughout the COVID-19 response and recovery efforts, and especially in humanitarian settings? And as you answer that, just try to bring a gendered lens into the efforts that you are putting in place.
Okay, thank you very much. And hello and good day to from Cox's Bazar to all the participants. And first of all, let me thank the organizers for inviting me and for you for putting this broad topic to the discussion that I just highlighted from the two triangles that you are talking about, the prioritization of the services for the women, children, and adolescents, and with the lens to the gender. As many of you may know that there are about 1 million refugees. They are hosted by the government of the Bangladesh in the refugee camps in Cox's Bazar. More than half of them, which is more than 500,000 of them, are children and adolescents. And they are living there in the same camps for the last 5 years. So saving life of them has been always a priority. But there were lots of good progress from 2017 to 2020, but in the middle, suddenly the pandemic came and there are some setbacks in lots of those indicators or achievements which we had. Then there was a commitment, and still there is a commitment, a very high commitment from government of Bangladesh and the humanitarian community, including the UN, the NGOs, the donor community, to provide the quality health care and health and nutrition care for women, children, and adolescents in the camps. During the COVID-19 pandemic in 2020, the first thing that the UN agencies did, they came together and they reviewed the joint response plan. Each year, the UN is developing a plan for the refugee response, and government of Bangladesh is involved, and they are endorsing or approving that plan. So in terms of priority, during the pandemic, UN reviewed all the interventions. They brought some additional inputs there that which interventions are missing and what to be the top priority. Fortunately, all the UN agencies, together with the government, they agreed that the child, woman, and adolescents' health to remain as a top priority. Interventions like vaccine delivery, immunization, providing emergency obstetric care, antenatal care, postnatal care, all of them become on the top of the interventions. Since there was need to expand the facilities to address the need of the COVID, one example of that was the health sector. They forecasted that there is need for additional 1,000 beds in the hospitals to address the problem of the COVID. So the distribution of the load work and in a coordinated manner among the UN agencies is something that we were proud of that. For example, at that time, UNICEF took the responsibility for establishing a 200-bed hospital for the COVID cases, which is called SARI-ITC, or Severe Acute Respiratory Infection Isolation Treatment Center. Similarly, the other partners did the same. Additional to that, since from the beginning of this emergency, the load, the total caseload is distributed among the different agencies. UNICEF is providing the quality reproductive, maternal, and newborn child and adolescents health services for 1/3 of this population, which is about 300,000 population. Then another example that I want to emphasize on that one is in the area of the nutrition. So the UN agency or the nutrition sector to just address the need of the caregivers, which in the most of the cases, it is the woman. So they changed their guideline and their strategy. So their admission criteria become very easy, and for only measuring the upper arm circumferences of the children, they start admission, just to reduce the contact between the service provider and the woman and the children. Similarly, the double amount of nutrition commodities were being distributed, again for the same sake, that the mothers and the caregivers not to come too much frequently and to reduce those ones. One last point that one last point that you talk about the services and the community services. One big lessons that we learned, there are thousands of the service providers, volunteer service providers, and majority of them, or most of them, are also the woman. So the more stronger community-based services you have, the more resilience the program will become. So with that one, I want to stop here. Thank you.
Thank you very much. And before you get off the screen, just very quickly and very briefly, how are you assisting or working with the government to now just to build the capacity? I know you've mentioned about the aspect of, limiting contacts between the service providers and those who come to seek service and all that, just to keep the service providers safe. But how else are you building the capacity of help? Especially, sorry, please, let's mute our mics if we are not on the virtual screen. Thank you very much. So how do you build the capacity of these service care providers, specifically as they work to provide services for women, children, and adolescents?
Okay, the provision of the capacity is not only the training. Of course, there are lots of sessions of the training which is happening, orientation, but then building the system and giving them the proper tools and equipments to enable them to provide the service, that makes more difference than only a knowledge component of that. So a package of the training, which includes the skills and the knowledge, not only by the UN agencies, all implementing partners, the international and national NGOs, we have developed this package of trainings together, and we are delivering to that to build the capacity of these service providers. And especially during the pandemic, it was really successful, because while there was lockdown, the access was very limited. So at that time, those community health workers were in the community providing those services for the refugees.
Thank you very much. And now let me come back to you, Professor Dr. Roshan, and very quickly, 30 seconds, could you just outline maybe 2 or 3 areas where you think more attention needs to be put to? I know you've talked about urban slums and, you know, the hard to reach areas, but can you pick out specifics of where you think we need to focus and put more attention to as we seek to deliver the promises we've made to women, children, and adolescents?
Okay, actually the urban slums are very much neglected because we are giving more community, especially my Professor Myrna was telling about the community care clinic. In the rural area, we have a community care clinic, we have the Upojala, but in the urban slums area, they are neglected. They are more urbanization is going on because 50% of urbanized people is coming and most are they are slum area. So slum area, we have to look after them through the UN agencies and other agencies and government also. They have to look after them, and the hard to reach area there also there no communication through anywhere because the rivers are there and they are very most of them the others near to river. There are no communication to the other center. So we have to specify on this urban slums area and also to the hard to reach area. During this pandemic also, with the UN agency, with the UNEP and the government also helped us in this area to work with them. And with the professional organization also, OGSB or working for them to improve the adolescents' health, maternal health, and also child health.
Thank you. Thank you very much. Thank you very much, Dr. Professor Dr. Roshan, Dr. Izzatullah Majid, and Ms. Sabrina Flora. I know we can talk about Bangladesh, we can talk about our individual countries for hours on end, but please allow me to end this here and welcome on the virtual stage our colleagues from Zimbabwe. And please allow me to invite Mr. Itai Rusike, who is the Executive Director, Community Working Group on Health, Zimbabwe. Welcome on stage, sir. And then we have Ms. Clarissa Regede from Youth Engage Zimbabwe. Please welcome to the virtual stage. And lastly, we have Ms. Chipo Chimamise, who's the Deputy Director, Maternal and Reproductive Health in the Ministry of Health and Childcare, Zimbabwe. And again, thank you very much, Ms. Chipo. You've been very active on chat. We really appreciate seeing all your comments and everything that you're doing. And I will start with you, Mr. Itai. What has been some of the most effective community-based solutions during COVID-19 response and recovery that looked at and addressed the needs of WCS in Zimbabwe? Mr. Itai is he on stage? No? All right, I'll come to you, Ms. Clarissa. Our young pastor. Hi, can you hear me?
Hi, how are you?
Hi.
Sorry, I'm out in the community, so I've been struggling with the connection, but I'm happy now I finally connected.
Good to see you. Thank you. Did you get my question?
No. Please, can you repeat?
Oh, first of all, you're very much welcome. And yeah, I put you on the spot. You're the first person on this panel. And I just wanted you to very briefly just give us, a snippet of what has been some of the most effective community-based solutions. And it's good that you're coming live from the community. What has been, the most effective solutions during COVID-19 response and recovery that addressed the needs of women, children, and young people in Zimbabwe?
Yes, I think to start with, it's important to also highlight that Zimbabwe faces, the threefold challenge, of responding to and mitigating, the COVID-19 pandemic on the population, while striving to maintain, essential health services and addressing other pressing and emerging, health issues. At the same time, experiencing, a significant economic shock. And in addition to the economic shock, health systems in Zimbabwe have, experienced, some serious disruptions during this COVID-19 pandemic. But it is also important that we also, as civil society, commend the government of Zimbabwe's commitment, to prioritize women and adolescents within its COVID-19 response and recovery plan. And despite the economic challenges in the country, I think Zimbabwe has done generally very well in terms of progress in its vaccination rollout program, and also in terms of procurement of the COVID-19 vaccines, using domestic resources. But I think the most important significant change that we have seen has been, involvement of communities, especially the community health workers. And in particular, the village health workers who are mainly in the rural areas, as, trusted, sources of information. The beauty of the village health workers is that they live in the community, they speak the local language. So they've got a direct interface with the communities. So even us as civil society, we started by training, community health workers to be in the forefront in terms of responding, to COVID-19. But we then also widened, the definition of the community health workers to include other sectors and other constituencies. In particular, the school health coordinators, the agriculture, extension officers, informal traders, public transport operators, hair salons. Because these are the people who have got direct, interface with the communities. But it was also important to identify champions, within the communities. And these champions were coming from, religious leaders, cultural leaders, including politicians and women organizations, so that they can encourage, their members, their followers to embrace, the COVID-19 vaccine. What we noticed at the beginning was that there was a challenge in terms of the information gap. And because of the information gap, we then experienced, misinformation, disinformation, vaccine hesitance, and also low uptake. So it was also important to bring the experience, of the HIV/AIDS, era, the early years of HIV/AIDS, in terms of sustained, COVID-19 literacy. Okay. So as civil society, we really played a key role in terms of, carrying out awareness, community-centered awareness, and making sure that there was community ownership, and not just community ownership, but there was also, informed community participation in the response to COVID-19. Yes. And what was also interesting at community level was the partnership with the community radio stations. Those, they played a very key role, because we developed, some messages, skits in vernacular languages, and we realized that the community radio stations had a wider reach, and people in communities, they listen to those community radio stations, and they can make a difference. But most importantly, the response has to use, the primary healthcare approach, and making sure that universal health coverage is in the forefront for us to have key results, especially at community level.
Thank you very much. And I hope in all these engagements, you did include the youth, right?
Yes, definitely. The youth were very key because,
very good. Now, just leave it there. Just leave it there, because we have a youth, a young person on stage. And I just want her to tell us, how as a youth and as youth engaged in Zimbabwe, they have actually advocated for women, children, and adolescents and their own health and rights to just improve the quality of care that is provided to them. And first of all, do you feel engaged? Is it saying the truth?
Oh no, yes, I wouldn't throw him under the bus, I'm joking. But yes, we've been engaged, and the Community Health Working Group is a very key organization that has been working with different types of marginalized groups. And to your question, I think it would be unfair not to acknowledge that civil society now recognizes that young people are not just participants, but they are now initiators, they're implementing change, and we're actually involved at donor, at national, and at local level. So to respond with our own interventions, I think one thing that has come out is the importance of data. And as Youth Engage, we've taken it upon ourselves to go into the community and record the successes, how government is doing well, or how government is not doing well in terms of giving young people what they want, or adolescents and young women what they want. And we have a very thriving scorecard that we have implemented in over 139 clinics in Zimbabwe with the support. And I think I really applaud all the previous speakers who were harnessing the importance of partnerships. I think without the partnerships that we have formed with the National AIDS Council, with the Global Fund, without the partnerships with Zimbabwe National Family Planning Council, would have never made the achievement that we have right now as Youth Engage. I think COVID-19 came to derail all the things that had been put in place in terms of advocacy when it comes to youth-led accountability. But it stayed alive, you know, all the progress has stayed alive only because there has been strong partnerships between youth-led and adult-led organizations. As Youth Engage, we've actually worked with other youth organizations. So it is not only our own success. I think our partnerships with other youth-led organizations such as Katswe Sisterhood, which works in Zimbabwe with sex workers and adolescent girls and young people, this has reaped a Global Fund actually paying attention and providing funding that's over 8 million for young people, you know, in their priorities. I think going further to talk about the strategies in terms of dialoguing, COVID-19 brought challenges. Never had we ever imagined that young people would never gather, young people would never caucus again. But through the strategies that had been in place before, we thank civil society for giving young people, especially in Zimbabwe, an opportunity to advocate in platforms such as the country coordinating mechanisms of the Global Fund. Because when COVID came, it was easy to say, we know this organization, we know what they're doing, we know the young people, we know these communities and what they need, because the young people have demanded these services. So I think on a positive note, we've been listening to so many stories and so many experiences. On a positive note, every foundation that was laid before COVID helped that youth-led accountability be in place. And I think to close my contribution on behalf of Youth Engage is, I think the power of partnerships certainly is required when we're talking about advocacy. And it's very important that we continue on that path, not leaving out young people in terms of opportunities for funding, because for us, the most difficult part of our advocacy was the funding. Young people only operate with less than $10,000 a year. You know, these are the young people who've actually gotten opportunities. So it's time that donors also commit funding to youth-led organizations for our accountability frameworks to work.
Oh, thank you. Thank you, Clarissa. And yeah, somebody on chat said, that's Rosine Bigirimana said, very excited to hear from Clarissa. So thank you so much for your comments. And now I'll come to you, Dr. Shipo Shimamise. What key institutional efforts have been undertaken to accelerate progress against the commitments that have been made by your government?
Okay, thank you. Let me start by thanking the organizers of this webinar, where we have a platform to share commitments, the progress of commitments to prioritize women, children, and adolescents within the COVID-19 response and recovery plans for Zimbabwe. Maybe just as a way of introducing my topic, let me say by August 19, 2021, Zimbabwe recorded more than 120,000 cases. And to take note that half of these were women and 1% of them being pregnant. And 11% of the cases were from children under 18. So with the surge of the COVID-19, the health systems were severely disrupted, disrupting service provision for all RAMCA interventions because of the restrictions of movement and gatherings through a series of lockdowns which were imposed. Also, fear of infection by both clients and health workers, and repurposing of both human resources for health and financial resources to channel them to fight against the COVID pandemic. So in such a background, Zimbabwe made commitments, 4 of them in August 2021, to make sure RAMCA services are accessible to women, children, and adolescents. So the first commitment was to increase domestic financing for the RMNCH and nutrition to 60%. So an increase of 60% from 2021 to 2022. Then the second commitment was to establish a second obstetric fistula repair center at the United Malawi hospitals, because by then we only had one such public facility. The third commitment was to review and update national policies, guidelines, and strategies to ensure continuity of RMNCH and N services in the context of COVID-19. And the fourth commitment by the country was to revitalize the primary KNS training program and to train about 1,000 nurses by end of 2022. Just a little explanation on each of the commitments. So on commitment number 1, which was on increasing domestic funding for RMNCH and AM services by 60% in 2022, thanks to partnerships, as my colleagues have already alluded to. Then in 2021, about $18 million in local currency was allocated to the Family Health Directorate for the RMNCH and nutrition services. But the government increased its efforts to about 115 million. And if we calculate this, it gives us a 131% increase against a target which was committed of 60%. But all figures have been said. Our main challenge in domestic financing is the volatile exchange rate between our currency and the United States dollars. So it erodes all most of the efforts done by the ministry. On the second commitment, which was to establish an obstetric fistula repair center at United Malawi hospitals, the ministry managed to do that in 2021, and that center alone repaired, although it's still operating at a low scale, so it's managed to repair about 15 cases. But the ministry has actually stepped up efforts to repair fistula, or to make this service accessible to even the hard to reach population. And it has scaled up this service to about 3 more. So now we have 5 fistula repair centers against 1 which was there in 2021. And during the COVID pandemic alone, 167 women have been repaired. Commitment number 3, which was review and update national policies and guidelines and strategies to ensure continuity of reproductive and maternal health services. So the Ministry of Health has revised its national health strategy. So we now have an operating national health strategy 2021 to 2025. We also developed a minimum initial service package for RMNCH guidelines in 2020. So these guidelines is focused on ensuring uninterrupted service provision for RMNCH, especially in emergencies, crisis, and humanitarian settings. Also under revision are the Adolescents Reproductive and Sexual Health Implementation Plan, the Cervical Cancer Strategy, the RMNCH strategy is also under revision right now. The fourth commitment was on revitalizing the primary care nurse training program, and this had been stopped in 2011, but it was resumed in September 2021 in effort to make service provision at grassroots level facilities available to women, adolescents, and children. And up to date now, 12 schools of nursing and they started enrolling in September 2021, a total of 176 primary care nurses who are still under training. Our main challenge is shortage of human resources for health.
Very briefly, Dr. Chipo, very briefly, the challenges in under 1 minute. Thank you.
Thank you. Frontline health services, health service providers, as well as trainers. Also inadequate skill sets for emergency obstetric and neonatal care, and inadequate resources for RMNCH and so this brings me to my short presentation. I would like to leave. Thank you.
Thank you. Thank you very much for that rundown. And I love how people are appreciating the, that we have young people who are, one, talking about data, who are being involved in driving conversations about health, not just in Kenya and Ukraine, but also in Zimbabwe and across the globe, especially the emphasis on partnerships in data as essential tools to improve children's, women, and adolescents' health. Wow, thank you very much. That's David Njiru. And then somebody else, Cletus Asari from Ghana, also appreciates that we are talking about data. The youth are talking about data. It's a good starting point, but it is important to partner with institutions that have the capacity to conduct quantitative studies as well. I think that's directed to you, Clarissa. So yeah, thank you very much again, our wonderful panelists. Please allow me to close this here. And before we wrap up the commitment section, I want to invite one more person on stage who will give the final remarks for this session, for the panelist session. And that is Dr. Juan Pablo Uribe, Global Director for Health, Nutrition, and Population at the World Bank, and Director of Global Financing Facility for Women, Children, and Adolescents, GFF. You're welcome on stage, Dr. Uribe. And yeah, we're now talking about money, money, money. The minister from Zimbabwe said, volatile exchange rate is an issue. People are talking about financing and just getting donor funding and all that. So please, welcome on stage. And we are asking you, where are the investments needed to ensure we reach women, children, adolescents with the healthcare they need in humanitarian and fragile settings? And what is the cost of inaction?
Thanks so much. And I'm so happy to meet you and to meet everybody. I want to start by praising, of course, PMNCH and the CORE Group, incredible leadership. And I'm honored to be invited here. I'm going to try to be very brief, but I want to start with something very incidental, but I think very powerful, listening to you and listening to the youth representatives and seeing for many years the importance of their work. Yesterday, I was precisely in the commencement speech of the graduation of my older daughter in a stadium filled with young people from all around the world. And the commencement speaker, in beautiful words, told them, thousands of young leaders in the world, that they bring three things, among many others, but three things that will stay with me. She told them that they bring creativity, they bring power, and they bring diverse voices. And I think this is extremely important, and I wanted to start with that anecdote. That said, it is very sad that the relevance of this summit is only increasing day by day, as we see war and conflict, and now inflation and food crisis mounting in so many places. And it is a terrible combination, basically, and for the most vulnerable, for the poor and the excluded, for the woman, the adolescent, and the infants. I want to start by that, because I think we need to always bring that equity focus into our discussions. GFF, the Global Financing Facility, Mercy, that you know that works precisely on women, adolescents, and infants, has seen firsthand what all of you have also seen in our countries and communities, and it's how the consequences of these combinations of adverse events and communities increase gender-based violence, increase exploitation, increase mental health issues, increase the deterioration of health outcomes, and I would say destroy trust among many communities. To your second question, the cost of inaction is huge. I would say it's unacceptable. It's more suffering, it's the destruction of dreams, and it's also the destruction of human capital that has taken years and decades of investments and of a lot of efforts from all our organizations to construct. So I would start by that second part. I think not acting is simply not an option. Now, GFF has been supporting numerous countries, low-income countries and their communities, has been trying at the same time as it contributes to the COVID vaccination response to maintain essential health services. Why is this important, Mercy? Because more than 90% of the countries, WHO has told us, have seen disruptions in services. And in GFF's data, the disruption has reached more than 25% of the essential services that normally were being delivered. How to respond to this, which is your first question. Where should the investments be? Where should we focus our efforts? 3 recommendations, again, coming out from the GFF experience and also from the work in the bank. I would say the first one is to maintain conscious and very strong focus on essential health services for the most needed. I'm talking about essential health services for the women, the adolescent, and the children. I'm talking about consciously doing all what we can to maintain those efforts in parallel with vaccinating with COVID or with other needed vaccines. We cannot stop those essential healthcare services to open spaces for other needed services. That's a huge contradiction. And again, we need to be conscious about how essential health services are being maintained and are functioning. Second recommendation, tied to the first one, we need the resources of our systems reaching the front lines. And that has also to be an explicit intention. I'm talking, of course, about the financing that has to reach the front line. I'm talking about the human resources, which are the core element of all our efforts. They need to be in the front line and they need to be financed. And I'm talking about, of course, core inputs like PPE in the case of COVID, but like vaccines and other supplies in essential health services. Talking about the workforce there, we should have in fragile and conflict situations an explicit effort in protecting them, in caring for them. We found that health workforce in those contexts, we don't have capacity to attend and to serve the communities. Most of the times, they're part of the community themselves. And again, caring for them has to be one of the top priorities in this second recommendation of direct resource allocation to the frontline. And the third and the last, Mercy, has to do the above, do the two above, maintaining essential services and making sure that resources are getting to the front lines through the institutions and the health system, through the organizations that are in the community, through the budgets, the official budgets. Try to do this on budget, try to regularize the health workforce and to formalize it, try to strengthen the governance of that health system in that locality. And it's through the systems that we're going to be able to sustain all these efforts. Why is this so important? And with this, I will conclude. Because acute crisis may pass. But these communities will always stay living in these places of fragility. And the only way in which we will really contribute to their improvement in living conditions and in health outcomes and in well-being is through sustained efforts that can only, again, be sustained if we do them through the organizations, through the communities, through the systems, and strengthening the institutions behind them. I will conclude. When we are able to do that, and I've seen it, for example, in my past experience in Colombia, a country with a lot of conflicts, with a lot of fragility, with a lot of pain for decades, when we're able to stay in a community, working with the community, with the civil society, with the young leaders, with the trusted leaders, and when we do that through the organizations and the institutions there, day by day, with the resources there, with the services there, you do not only help improve the conditions and build better health systems, Mercy, you also build trust. And it's only with trust that we can really make a difference in the fragile and conflict places. Thanks so much.
Wow. Thank you so much. Thank you so much, Dr. Uribe. It's only with trust that we can be able to make, strides that we are looking at and cover the gaps. And I'm delighted and happy that you mentioned the role of community and why we really needed to have community-led and community-focused interventions. And most importantly, ensuring that the financing needs and the finances that we give reach the front lines and those who need the most. Thank you very much for your time. I know you have to run elsewhere, so we really appreciate you being here and for your insights. Thank you so much, Dr. Uribe. Now, we are going to go to our final remarks for the day. It's always, a very, very meh feeling to see that you're coming to the end of these conversations, because these are, things that we can talk about and really sit down and discuss for days. But we have crammed this into 2.5 hours, which is enough because it gives us an assignment to now go out and continue the conversations elsewhere. So to give the final remarks on keeping commitments and sustaining action, please allow me to introduce these two women, powerhouses in the global sector. Their strong commitment to championing for the health and well-being of women, children, and adolescents is unmatched. And they also represent the co-hosts, PMNCH and CORE Group, who have enabled us to have these conversations today and have facilitated the last 3 Lives in the Balance Summit. So we are really, really grateful to PMNCH, to CORE Group, and to now Lisa Helmy, who is the Executive Director of CORE Group based in Washington, DC, and Helga Fogstad, who is the Executive Director of the Partnership for Maternal, Newborn, and Child Health. Here they are.
Thank you, Mercy, for your incredible moderation and really an inspiring panel. Today has been an opportunity for all of us to learn, to listen, to jointly reflect, and to share and identify ways to collaborate for a fairer and a more equitable world where all are able to realize their human rights. Our aim and effort with each of these Lives in the Balance summits we've held to date have been to listen to what others in the community have to say so that our collective response is targeted and fit for purpose, especially in crisis situations where stakes are so high and room for error is low. But this isn't an effort that each of us also need to make in our daily professional lives. We cannot bring about meaningful and sustainable change if we continue to only talk about the need for community-led, locally driven, people-centered care and a bottom-up approach. We need to move beyond lip service and do a better job of understanding what embodying these approaches actually entails. This starts by humbly listening and being open to learning from the women, children, and adolescents that we hope to reach with our work, and from the local organizations and frontline health workers that know their communities inside out. Helga, what do you think?
Thank you. Absolutely, Lisa. Recent evidence has highlighted the essential role of community engagement awareness, trust, and support in delivering secure and safe care to vulnerable women, children, and adolescents, especially in humanitarian and fragile settings. But it doesn't only stop at listening and learning from the community. We are striving to serve. If we want impact at scale and respond to the needs and requests, we also need to be able to build more meaningful partnerships within and across communities. These meaningful partnerships need to be across sectors, across different constituencies, and partners to unleash our collective potential. This is a journey that can only be made together, as well as what we've heard today in the previous panel from multiple stakeholders from our commitment countries. The progress made till date has only been possible because our partners are committed to working together, especially in the hardest of circumstances. But this is a drop in the ocean that we have not yet fully unleashed its potential. In order for us to build forward better and fairer and achieve the SDGs and make universal health a reality for all, we need collective action across all levels and across all sectors.
Yes, Helga. The question we need to ask ourselves is, if not now, when? If not us collectively, who? More than 2 billion people, including half the world's poorest women, children, and adolescents, live in humanitarian and fragile settings where progress on the SDGs and UHC was lagging behind even before the COVID-19 pandemic. Evidence has shown that many life-saving services, including the majority of reproductive, newborn, and adolescent health services, are not being delivered in crisis settings, and interventions to address stillbirths are absent. The intergenerational effects of war and other crises, such as low birth weight, developmental delays, chronic illness, mental health problems, and intergenerational violence, will only continue to grow if we continue with business as usual. This isn't only about responding to new crises the world is experiencing or observing. This is about making sure that we as a community don't lose sight of what needs to be done to also reach the most vulnerable, the underserved women, children, and adolescents, including in the remotest and hardest of areas, no matter what ethnicity, race, or religion they belong to, or what their legal status is, from Ethiopia to Afghanistan, from Colombia to Myanmar, from Palestine to Ukraine. At CORE Group, we're committed to working with communities, to learn from them, to listen to them, and foster collaboration and action for improved health and well-being. And thank you, PMNCH, for bringing us together.
Thank you for that, Elisa. A quick thought about Ukraine and how our hearts and efforts go out to them. But it is at the same time critical that financing that does not happen at the expense of ODA to the poorest in Africa and other regions. So this is something that we need to really call out very loud. And it did, indeed, it all starts, with us and our partnerships in coming together. So PMNCH stands ready with its 1,250 organizations to take a responsibility to galvanize evidence-based multi-sectoral action and drive the political will that is needed to ensure the rights to health of all women, children, and adolescents everywhere, so that we are able to deliver on our commitments and promises. We're not starting from scratch, as the expert interviews Mercy did in the lead up to this summit and discussions today have demonstrated. Evidence is emerging to inform the way forward. Now, we just need to move away from rhetoric messages to impactful and collective actions based on evidence-grounded approaches and solutions. From our end, PMNCH will continue to create opportunities for our community to come together to share their experiences, knowledge, and learnings. But in the meantime, I encourage you all to get in touch with us at PMNCH and use PMNCH's platform to build meaningful partnerships to forge a more effective road to delivering on universal health and the SDGs for every single woman, child, and adolescents. So lastly, a huge thank you to you, Lisa, and as well as to Mercy for all her coordination. Thanks from all of us. Thank you.
Thank you. Thank you very much, Lisa and Helga. Always such a pleasure to listen to you. And thank you for all your commitment, all the partnerships that you're forging and your resilience and constant efforts to better the lives and health and well-being of women, children, and adolescents. Now, ladies and gentlemen, we've come to the end of our event today. And no, we are not just letting you go like that without, giving you some really, really good positive vibes and energy. And at this juncture, please allow me to introduce the last person you'll see on screen today. And this is Asmahan Ahmed, a person and a lady who I really appreciate, Somali-Canadian writer, poet, and spoken word artist who is now in Somalia. Asmahan, the virtual stage is yours. Welcome.
Thank you so much for having me, and I'm so honored to be a part of this conversation and this event. As has been mentioned many times throughout the last 2 hours, in any humanitarian crisis, women and children suffer the most. And as someone who is in Africa, I have been able to see that firsthand. I know their names, I know their families, I know their stories, I see them. And so this poem was very easy to write, and I just want to dedicate it to all the women and all the daughters in the world that don't get to live up to their truest potential. A daughter. My name is Hadia. In Somali, my name means gift, but I am quite the opposite to my father, for a daughter is never a man's first pick. Although a daughter can be quite useful, I have some value, you see. A daughter is as valuable as a dowry paid when she gets married. My father will receive camels or goats in exchange for me. A daughter doesn't play outside all day like the boys. A daughter must cook and clean. My mother keeps having more children, so my mommy and me, we've become a team. She delivers the babies, and I care for them when she goes to work. But sometimes I wonder, who is the mother? Because I am with the children more than her. I love taking care of my siblings. That is what daughters do. A daughter washes all the clothes for her family. A daughter makes afternoon tea for her dad, and sometimes for his friends too. A daughter has things that are special. There are secrets between my legs. Mommy said, that is why they must cut me down there. She just stared as I cried and I begged. Daughters are never selfish. Daughters are there but not seen. Daughters work hard, they don't get to rest, while boys play soccer outside and then come home to sleep. Daughters don't have life goals. Daughters don't dare to dream. Daughters are human slaves. Daughters will never be free. Daughters get married off to the highest bidder. Daughter's first night with her husband feels like she's sleeping with a killer. Mommy cut out the secrets between daughter's legs. Daughter is scared. She is carrying a baby. Daughter looks at her mother with betrayal, wondering, why did she never try to save me? You see, mother was once a daughter, and now the daughter is me. I am tired of carrying this weight I give birth outside, sitting under a tree. Now I have my own daughter, and she will grow up to be just like me. I will pass down all that I know, then she will have a daughter, and the cycle will repeat. Daughters will never be free. Thank you.
Oh, wow. Sorry, guys. I have a daughter, so yeah, thank you, Asmahan. And yeah, thank you, everyone. Yeah, and I really hope that we really, reflect on the kind of world that we are living to. The daughters of Africa, the daughters of all these countries that are in constant crisis, in constant conflicts, that have to endure, effects of climate change, even though they don't contribute to, the emissions that we're talking about. And I really hope that we carry these discussions forward. And like I said, we just don't leave this here. So once again, ladies and gentlemen, thank you so much for taking your time to be with us the last 2.5 hours. We really appreciate you. And thank you so much to PMNCH and to CORE Group and to all the participants for your time. And please keep the conversations going. And like Helga said, if you go to the PMNCH website, there are a lot of resources that can help you to push your messages, that can help us to advocate for the health and well-being of women, children, and adolescents today in this world where we are seeing so many crises, so many conflicts, the effect of climate change. We are in the middle of the pandemic. So please do not get tired. Thank you so much. And I wish you all a beautiful rest of the day, even as you reflect on the conversations that we have had. Thank you so much. And it's goodbye from me.